drugs. Unfortunately, we don't become tolerant to the respiratory effect that it has in shutting down our respiratory system. So someone will take a big dose of drugs in order to get that high effect or the desired effect that they want, even sometimes the pain relief. But we're still taking enough of it so that it shuts down our respiratory system and we die. Okay? Drug tolerance, so a need for an increasingly larger dose to get the same effect. Decreased effect after repeated use. This can also be, there can be cross tolerance if you have drugs that are chemically related to each other, okay, that can have this kind of tolerance effect. Where you have someone who took pain medication because of some surgery that they had to get rid of the pain, and they were taking it for a period of time, so this time, even though the doctor said take 1, they took 3. Because last time they had that tolerance, it took 3 to knock down the pain, but they really only needed 1. So they might have more negative side effects without more pain relief. Okay? So this is what can happen for pain, for medications that have a very low safety profile, like opioids. People take more and more to get the desired effect, but the negative effects are a lot stronger. Yes?
Could cross tolerance also be like invalid?
Yes. And that's, you're probably thinking there, it has more to do with cross, usually has more to do with negative effects like allergies to it. But in terms of how well it works, possibly. Most of the time we're talking about antibiotics, we're talking about there being cross-sensitivity. Yeah, cross-sensitivity because of allergic or adverse effects. Yes, Maria?
You said allergy. Yeah. Say what's the effect? Like you take one, and if it's after a while it doesn't work to get the treated. I mean, so would you take like more than one? There would be tolerance for that too.
It could be, but remember there's a safety range.
Yeah.
You know, and how well it's working might also depend on how sensitive you are to the things that are making you allergic. But that's why there's a range. So one person might need 1, and one person might need 3, as long as you stay within the safety range, because remember there's adverse effects too, right? So it might dry you out and do too much. The word tachyphylaxis is actually the term for the very rapid development of tolerance, and subdrugs are subject to that. What about a patient that has other pathological states? So somebody has a lot of medical conditions, okay? So if they have disease, particularly something like liver or kidney disease, they may respond to medication differently than another person. There also might be a disease like hypothyroidism, okay? And these people are extremely sensitive to epinephrine. You give epinephrine, that's a drug, you administer drugs, okay? We give epinephrine. So if you have someone with especially uncontrolled hyperthyroidism, okay, they're going to be affected very greatly by the toxic effects of epinephrine, which may include heart palpitations, okay? Liver and kidney disease is a huge one, huge. What about the time it's administered? Okay, that can have an effect on the drug, especially with the relationship to meals and how well the drug is going to be absorbed, okay? Food may slow the absorption, it might still have the same effect, it might take longer to work. And we know that if drugs have a sedative effect, the old antihistamines, okay, people would only take them at bedtime because they made them so sleepy, okay? In certain classes, right? You know, can make them sleepy as well. All right, probably right about at this point. You guys doing all right? Remember, leave, go to the restroom if you need to. Got a little while to go. Okay, enteral routes, which means anything like through the body, rectal or oral routes, okay? They're slower. They're less predictable because of all the variations, but safer than parenteral routes because we know that injecting something into the body, especially into the bloodstream, okay, has a very quick effect. And once it's in your bloodstream, you can't just pop it out of there, okay? So it can be also less safe. There is genetic and gender variation between how some drugs affect us. And with women, we talk about hormones having more an effect, pregnancy, nursing, all of these kinds of things that we have to be careful about certain drugs that can pass over to the fetus. So that's something that needs to be determined. And the earlier in the pregnancy you are, the more likely that it could have an effect, okay? It would have a greater effect, most drugs. Again, genetic variations, certain populations are more sensitive or less sensitive to certain drugs. We know that patients taking a lot of medications, drug-drug interactions are possible. There's also certain foods we tell people not to eat or drink when they're taking a certain medication. And then drug disease, as we talked about before. like with hyperthyroidism or something like that. There are interactions there. Age and weight, how we metabolize drugs is largely dependent on our age, our size, our ability to metabolize them, okay? With a child, it's not their age, it's their size or their weight that has more of an effect, okay? Older patients definitely respond more differently. Some drugs work less well and some drugs work way too well. How about the environment? We talked about the smoking and the sip, okay, enzymes, including people that are inhaling smoke that someone else is smoking. So with something like a benzodiazepine, an anti-anxiety drug, they need more of it if they're smokers. And even people, they found this with agricultural workers, pesticides and solvents can have an effect on the drug's action as well. We already talked a little bit about patient interaction, can have a huge effect on how the drug works. If the patient believes it works and if you've given the correct information, you're going to usually have a much better success rate. Okay, we're going to go through these drug routes of administration actually pretty quickly, okay? We know that the route of administration can affect how quickly the drug works and how long it lasts. Enteral into the GI system, parenteral is basically injection, okay? There are also parenteral routes can also be topical or intranasally or sublingually. Those are other enteral routes. Parenteral routes. Oral route, least expensive, most common, okay, it's pretty safe, even though it's variable as to how quickly it works. This can be, a large area in the intestines to absorb the drugs, but it has a slower onset of action, and we use that, okay, that slow, steady interaction of it going into the body. But disadvantages could be that the drugs can upset the lining of the stomach and make you nauseous or cause you to vomit, okay? The drugs can be broken down by enzymes within the gastric juices and then make them less effective. The blood levels are less predictable because of all of those variations. And drug interactions, if there's two drugs in your stomach, and they can actually interact with each other within that environment, okay? And we also have to get patients to take them, okay, and take them on time, and take them as often as they're supposed to, and they don't like them if they upset their stomach. And we know that some are subjected to the first pass effect, okay? So we already know what that is. I think we went through that. Drugs can be given rectally, and they may do this with some drugs that are antiemetics, because if you're vomiting and nauseous, you don't want to take a drug orally, or it may be vomited back up. And it's sometimes given for the systemic effect through the rectal route, okay? So some antiemetics are actually given that way because of that. Advantages of the parenteral route, okay, are that it's actually very, very quick absorption. And it may be given in a variety of different parts of our bodies and a variety of different layers of the skin, okay? And some drugs are inactivated by going into the enteral route. For instance, insulin is a protein, so you don't take it because your stomach's going to break it down as a protein, and it won't have the effect that it's supposed to have. But disadvantages may be asepsis, and I see a lot of drugs being injected without people without gloves on. Did you ever notice that? It happens. Hopefully their hands are at least clean, okay? You may get it into the intravascular, an IV drug that you don't want to be IV, which is why when people learn how to do local anesthesia, you learn how to not do that. Once it's in there, you can't get it out, okay? It's there. Adverse effects would be quicker and much more pronounced and could be more dramatic. It's hard to inject yourself, although some people do it for some drugs. And it's more dangerous and more expensive because of all of those things. So the IV route has the most rapid response. This is great in emergency situations. It's more predictable. We know that it's there, okay? But it's irretrievable at that point, okay? Intramuscular route can happen. And there's a good blood supply in the muscle, so the drug does get taken up, but it gets taken up a little bit more slowly, okay? And this is good for drugs that we want to work, like an antibiotic that I described, over a period of time. Subcutaneous means under the skin, literally, and we actually will do this with drugs like insulin, and even our local anesthetic is actually going to be administered into these subdermal layer, if you will. And it can produce a little bleb. So if you guys had your PPE test done, okay, it had that little bleb there, it can cause that, which is sometimes called a sterile abscess. and it can be put into the intramuscular area, which we see is very deep. We see the subcutaneous, we see the intravenous into the vein itself, and the intradermal into the layer just under the dermis of the skin. Okay, there's different. This isn't in your book. I just thought it was a good summary of them. We also hear about drugs being administered into the spine in the epidural and intrathecal. Your book, I don't know why it doesn't mention epidural, but we all know about that, right? So that's outside the outermost layer of the spine. That's epidural. Intrathecal goes into the middle of the layer of the spine. And this is sometimes used for spinal anesthesia. Okay, some drugs delivered for meningitis, which is a severe infection of that area. Some drugs are delivered into the abdominal cavity. Okay, so this is where exchange of liquids occurs. This is where people have dialysis, right, into this peritoneal cavity, if you will. That's done there, and drugs can be administered that way as well. We know about inhalation, right, with asthma medications. There's actually general anesthetics are inhaled, right? There's actually a new diabetes medication which is delivered that way, Afrezza, a very new one, which we'll talk about when we talk about diabetes. So quite interesting. We know about topicals, right? We're going to be applying topicals, so they can be delivered to the skin or to the oral mucosa. And it can be delivered so that it has an effect in the local area, but also delivered so that it is absorbed through the skin as well. Okay, so the side effects, can occur, but they're rare. Actually, if you took, I forgot the amount now, a very small amount of pure nicotine, and you put it onto someone's skin, and it could actually cause death. Okay, because it's very, right? So it can be absorbed systemically. Isn't that wild? Yeah, so I'm not talking about breaking apart a cigarette. We're talking about actual nicotine itself. Really wild stuff. Topical corticosteroids, okay? We know that we avoid them over a large portion of the body. They might be used as a cream in a very small area. We have to be really careful of that and look at what area of the body we're applying it to. Some drugs are delivered as a patch. So we've seen the nicotine patches, as a matter of fact. Isn't that interesting? Nitroglycerin can be delivered this way for people that have really common angina attacks. And there are actually some slow delivery drugs for people with Alzheimer's that are delivered this way as well. We also know there are drugs that are sprayed or put under the tongue in the sublingual area. So kind of interesting. There's actually a drug for epilepsy for children that is delivered, as an oral liquid. Actually, that's not the one. The one for multiple sclerosis symptoms, there's one that's actually delivered under the tongue. Sublingual strips and gels you're going to be using, okay, with like the Arrestin we talked about, Atrodox, Cariochip, they're delivered that way. And some topical anesthesias, and the one that you're going to be, have you guys learned about Orchix? Are you doing that this semester? Very cool. Yeah. Those are actually 2 injectable anesthetics, but they're delivered for their local effect that they have. So it's considered a topical effect of something which is usually injected. And the sublingual and buccal roots that we just talked about can happen as well. There are implants, drugs that are implants. There's a oral contraceptive, not oral contraceptive, contraceptive which is implanted under the skin. And there are pumps that can deliver things like insulin and can be regulated from the outside. So a lot of the dose forms are there for you. The most common ones we know are the tablets and the capsules, and the injected dose forms as well. So take a look at those. Do you believe we're done? Yes. Is that a big one? Are you clear? Stuff,
Yeah.
right?
A little.
A little bit. Yep. It's going to take a little while. Go back. This is good material to go back to. Now we're going to try something different. Okay, we're going to do our quiz. You're going to help me out with this, okay? No. Can I ask you guys to bear with me because it's new with a big group like this? We're going to take a real brief. Do you want, like, if I give you 5 minutes, would that be helpful? Or do you want to just go with it? Just go with it, okay? If anyone needs to leave now while we're setting stuff up, okay? And I'm going to get real quick, 5 minutes, real quick.